minute and let us know where you're from today. That would be awesome. We'd love to see where everybody's from. And yeah, I will be one of the presenters, Bonnie Tompkins, as well as Eman Hassan from the BC Centre of Palliative Care and Émilie Lessard from the Patient Partnership Research Project out of Montreal. I may not have gotten that completely correct. Yeah, so let's get started. So we just wanted to take a minute to do, a territorial honoring. So on behalf of all three of us presenters today, we are spread out across the country. We wanted to acknowledge that from coast to coast to coast, we live and work on the traditional, ancestral, and unceded territory of all the Inuit, Métis, and First Nation people that call this land their home. As healthcare organizations, we are committed to reconciliation and undoing ongoing colonial processes in our workplaces. Also want to take a minute to just acknowledge the Palliative Care ECHO Project. So it's a project that's been around for 5 years, and it's an initiative that's designed to cultivate communities of practice and establish continual professional development within the space for healthcare providers. We have community as well, and just sort of improve our ability to provide quality palliative care. We'd also like to acknowledge Health Canada's funding of the ECHO project. Just a few sort of housekeeping pieces before we get started. So as I mentioned, introduce yourself in the chat. So I can tell already people are doing that. So that's awesome. If you have any questions, we'd really, really appreciate it if you could put them in the Q&A function. Just makes it easier for us to be able to make sure we get them all answered for you. There will be a couple of spots throughout the workshop where we'll take a pause and answer questions, just because we are actively working through some examples. Otherwise, please use the chat to comments. If you're having any technical issues, we do have two staff member from the ECHO project on here who are supporting us today. So thank you to them. So they'll be able to help you guys out if you're having any technical issues. The session is recorded, so you will be able to see it after. An email will go out after with that recording. I believe the slide deck's included as well. And just the last piece being a reminder not to disclose any personal health information today during the session. So just, some of the pieces we need to get out of the way. So one of the things that we are very proud of, this project has been going for many years. I think we're probably 7 now, Eman. We are self-funded. So the 3 organizations you see on the screen here, we have self-funded this project. We didn't receive funding from anyone. So we're quite proud to be able to share the guide with you guys and help you work through it today. And all 3 presenters have nothing to disclose. Just in relationship to financial sponsorship, so Pallium Canada is a not-for-profit, and we do receive some funding from Health Canada. And regarding the BC Centre of Palliative Care, again, a not-for-profit, and they receive some funding from the BC Ministry of Health. And just sort of quickly, I already covered some of this, but I'm Bonnie Tompkins. I work for Pallium. Eman Hassan, who the 2 of us have been involved in this project from the very beginning. He's the executive director from the BC Centre of Palliative Care. Émilie Lessard out of Montreal is a participatory evaluator lead or evaluation lead, and she works with the Canadian Research Chair in Partnerships and Patient and Communities. I got it right that time. I knew it was a long one. All right, and then we have Aaliyah and Diana on supporting us. Okay, let's get started. So what's going to happen in this session today? So I'm going to cover the first section, which is just about the guide, why it was created, letting you know all the tools that come with the guide to support you in using it and building your own evaluation plan. And then we're going to get into how to use it. And so Eman will be up first, walking us through an example, sort of real life example that exists and how the evaluation guide supported it. And then Émilie will be up next doing another example. And Émilie, with her role in Montreal, actually was one of the pilot sites for this guide. So she's going to be able to share some insight from that pilot piece as well. And then, as I mentioned, there'll be opportunities to ask questions throughout. Okay, so who's the primary audience for this guide? It's really for anyone. It is definitely there to support people who are newer to evaluation, maybe don't have strong evaluation knowledge and experience. And it really is there to support those community initiatives. I did receive an email around this workshop earlier, and how a group thought that they didn't qualify, but they were interested. And so as a part of the project, the Pan-Canadian Compassionate Communities Evaluation Project that created this guide, you know, we very much see people who are working on age-friendly, people who are working on dementia-friendly, even social prescribing. You know, there's a lot of overlap there. And so this evaluation guide may be helpful for you in relation to building your own evaluation plan. So yes, while it says compassionate communities, I think if you're supporting caregivers, people who are grieving, people dealing with serious illness, there will be many pieces within this guide that will be applicable for you. Secondary audience, anyone that is starting or leading a community initiative that's focused on those topic areas that I had mentioned. So really the purpose of the guide, we tried to embed a few different pieces because we are mindful of the people who are most likely going to use this resource didn't have a lot of knowledge around evaluation. I was one of those people starting on this project journey. So we included a lot of other pieces to sort of give you a good foundation for when you were building your evaluation and doing your evaluation work. So learning about the compassionate communities movement in Canada itself. You may notice we are dropping some tools into the chat. So one of the tools in there will be the Compassionate Community Stages of Development in Canada, and that's a resource that came out of this work. We also put content in there to help you with, you know, basic understanding of evaluation concepts, right? And helping you figure out how to describe your initiative, your goals, your target audience, all those pieces. Choosing the right evaluation, right? So understanding what are those different types of evaluations and which one makes sense for me at this time. So pieces in there to help you with that. We've got pieces to help pick your evaluation questions. And so at some point, an evaluation framework will be dropped into the chat if you don't have it already. And that, for instance, is the tool that's going to help you there. Creating a plan for your evaluation itself. So obviously that's covered in the guide. And then we, at the end of the guide, just populated a lot of really great resources that many of us use ourselves to help with different aspects of evaluation. So we included those in there for you. Okay, let's take a look inside. So first is an evaluation plan. So we created two versions for you. So there's a paper copy, which hopefully will be dropped in the chat. And so you can work through that paper copy. You can keep it, or it's a digital, but we call it a hard copy. And so you can use that and work through that document. We've also included an example so you can get a sense of how to fill out the document as well. There's also an online version, and we did that because we know some people, you know, really like the online approach to things. And the benefit of using the online version is if you provide your email when you're filling it out, you will actually get a code, an email with a code in it. So if you say want to go back and update it in 2 or 3 months time, you would just pull up that email, click that link or code, and it would bring you back to your original evaluation plan. So you're not starting from scratch. Then you can just start to go through and change. So that's sort of the pros and cons of the two versions, but we did create you guys a plan to fill out. A plan checklist. So this is included in the guide, and I know it'll get touched on, I believe, later in the session. But we really tried to just help you understand the process from creating your evaluation team and what are the tips to think about when doing that, through to creating your plan, creating a budget, next steps, right? So we've kind of created you guys a little checklist that you can use and guide you along the way. Stages of development. So you heard me allude to this piece a few minutes ago, and I believe it's been dropped in the chat, the document. And so this is a big piece of the project as well, because we really spend a lot of time working with compassionate community initiatives across the country to figure out what are their typical stages that they go through. And so that's this resource here. And it will really help you, as you'll see as you get into the examples. It helps you understand, okay, I'm at the co-planning stage. Well, what evaluation type aligns up with that? So you'll see that later on in the session. So this becomes a really great piece for you to use again and again and to come back to kind of see, where am I at? Okay, what are my next stages coming up? And then, oh, here's the evaluation types that are going to line up with that. Here's the database. So it's a big Excel document that you will probably see in the chat. And you'll notice here it starts off with initiative stage, that piece I just showed you a second ago, that image. And so you always start there, and then that helps you decide on your evaluation type. And then we're basically going to just work from left to right when we use the examples. And that's how your evaluation plan template, whatever version you use, is laid out that way. Your first question will be, what is your stage that your initiative is at? Okay, then that's this about, and you just go along basically. The other thing I would just like to mention is, while we put a lot of questions in here, we may not have come up with them all. And so on both versions of the evaluation plan, we encourage you to write down other questions that you may want to be asking that's specific for your initiative. So you may not see it in here. You may see something similar. So don't be afraid to add in your own pieces. A lot of the data tracking and stuff may align with the type of question you're asking. And just some of the other resources that exist. So we have a logic model in there. We talk about logic models. So it's a very common tool that's used with this kind of work. We have pieces in here from growing your evaluation knowledge. So if you are a beginner and you want to just understand things a bit better, you can see here, we've got some really great websites or articles that you can go to just grow that knowledge. And then tools to just help you get started on your evaluation. An example of a logic model. So there is one of those in there as well for you. And I believe Eman will be using one in her example today. And how to get access to the guide. So you can find it on Pallium's website. You will find it on the BC Centre of Palliative Care. You will also find it on, I believe, HPCO's website, because they were one of the original collaborators with us on the development of this resource. I put a lot of those pieces in here today. We know that there may have been some issues with downloading the guide. So if you still don't have a copy, please leave a message in the chat and we can, if we haven't already, give you that copy. One other thing I'll just mention, because I know I'm going to hand over control to Eman in a few minutes, is just we have in the guide, you'll see a section where we're asking for your feedback. So we really, because we were piloting during the pandemic, I imagine many of you will feel the pain of what I'm about to say. It didn't go so well. And so this is basically our first version, right? And so we want to get feedback from people who are using the guide, reading it, using the tools, so that we can strengthen it, make adjustments before then we go to look at translating it into French as well. So please, if you are engaging at all, just take a minute. It's an online Google form, and just provide us with some of that feedback. any questions out there? I'm also going to hand it over to Eman. So if you want to unmute Eman. All right. It looks like we don't have any questions. I can see a lot of the resources have been dropped into the chat, which is great. Take that as a sign that I did a great job. Over to you, Eman.
Okay, thank you so much, Bonnie. I'm really excited to be here with you all today. This free resource, it's very dear to my heart. We invested a lot of time and knowledge, and we developed it, on the side of our desks. So, because we believe that evaluating the evaluation or enabling the people like you to evaluate your important work will help us at the end of the day to generate some evidence and knowledge about the impact of this important work in your community or on the people that you're trying to help. And this will also eventually will make the case for hopefully for some funding or some support, acknowledgement, although we do have acknowledgement by national organizations like the Health Canada. Now it's in the National Framework for Palliative Care. Compassionate community is mentioned as one of the best practices to help people live well in their communities, feel supported, and contribute to improving the quality of life of patients and families who have an experience of life-limiting illness or serious illness, grieving and caregiving, all these experiences. So, and I'm really excited to see that we have a big group today joining us, and they are interested in learning about the, how we can, what's included in the guide and how we can use the guide in practice. So, in my case study, let's explore together how we can use the guide to create an evaluation plan for an initiative that's still in the early stage of development, still an idea that you want to implement or deliver. So, and what type of evaluation we can use, or what can we assess or track over time, now and in the future. So my case study, the case study that I'll be using, it's an idea for establishing or developing a volunteer-led advanced care planning sessions in a community. So let's look together into that. The guide provides, I find it very helpful, that before we begin creating the evaluation planning exercise or starting the evaluation planning exercise, the guide suggests some helpful tips that such as making sure that you have an evaluation team. You are not alone. You need to have the people who will be planning the initiative together with you. They need to be on board with regards to creating an evaluation plan for this work. And you need to make sure that you use the evaluation planning checklist, because it's very simple and you can go follow these steps together as a group to create the plan. Start with a simple evaluation plan that your team and you can handle and can learn from. Don't feel overwhelmed that you need to create the best one or the very comprehensive. Starting with small evaluation plan and you can learn together from, and then you can build on that plan later. So it's it doesn't have to be all or none. So let's now follow the steps outlined in the checklist for in our case study. So the initiative idea is that the group is interested to deliver volunteer-led advanced care planning information sessions to enhance public awareness and engagement in advanced care planning. So, and why the reason they wanted to do that is that they want to empower people in their community to advocate for care that's aligned with their wishes, through the engagement in advanced care planning, having their wishes expressed and shared with people who are important to them, people who will be involved in healthcare decision making if the person lost the capacity to make these decisions themselves. And where this initiative will be delivered, the group, they are based in a city of the city of Chilliwack in BC. It's we have in that city about 90,000 people living there, and it's located 100 kilometers east of Vancouver. The population there is characterized by being mostly an older adult population. So let's see together. One of the most important steps is to describe the initiative in terms of the who, the what, the how, and in this slide we are looking at the how, and the group basically looked at the activities that will eventually or ultimately will lead them to have an initiative and deliver the initiative in terms of the advanced care planning sessions. So the team identified key activities that starts with a good understanding of the problem that the initiative will address, and this will include or encompasses the identification of the target populations, like are they going to deliver this or promote this information sessions to the whole population, or do they need to target and or focus their marketing activities and advertisement and reaching out to the people, population group that will benefit the most from this information session. They also, what part of the activities is that they need to promote the idea of doing this type of activity using a credible model and a low-cost resource that already exists. For example, the content of the session and the tools that the facilitators will be using. The content needs to be trusted, needs to be accurate. Providing like accurate information. It has to, ideally it should be tested by others. So in this example, the credible model that they reached out to is the model that at the BC Center we developed, and that includes or provides training to community members who are interested to become facilitators for advanced care planning sessions, and we provide a toolkit that include everything the facilitator and the community groups will need, as well as to deliver these sessions, as well as some coaching, after when they start delivering the sessions, like if they are facing some challenges, they need like someone to talk to, how to address or mitigate these challenges and risks. So we have a community development specialist that provide that. So in this case, the Chilliwack group, they basically reach out to us at the center to get their volunteers trained and have access to our toolkit. And the other activities also include exploring the community interest and confirm their buy-in. It's very important that what the initiative that will be that we have in mind, that we have the buy-in and the commitment from the community, and reaching out to potential partners and sponsors, securing resources that are required to support the delivery of the sessions. That includes volunteers and coordinator, advertising, logistical resources, etc., and a training program. As I said, that their volunteers will need to complete. And they thought about testing the delivery of 2 to 3 sessions so they can learn from and improve the content and the delivery methods as needed. And what they did is that later, when they started with in-person sessions, and when COVID hit, they transitioned to online sessions. Mapping out the initiative components, the who, the what, the why, and all the information that I just shared with you in the description exercise of the initiative could be, mapping them and using a logic model is an optional step, but many find this visual description of the initiative very helpful. And the logic model template prompts people or the team to think together about the expected outputs and outcomes of the planned activities that they are thought about and they intend to do. This information, as we look at them right now on one page, help you identify the important areas to evaluate or to focus the evaluation on now and in the future. And as you can see here, the template that I used here, it has been adapted from the template that Bonnie shared or exists in the guide. For example, the template in the guide has short-term outcomes, long-term outcomes, and intermediate, I believe, outcomes as well. Here, I didn't and I did that intentionally. I just wanted to show you that you can adapt the template to, the information and the level of comfort and confidence that you have. So I said outcomes. Now, these are the people that I will be reaching out to, the volunteers, and recruit and engage in the delivery of my initiative, and the public participants that will, this is the target population that I would I hope to achieve and have an influence or impact in the level of knowledge and engagement and awareness, etc. So let's be clear on the expected outcomes of the planned activities on these two groups. I don't want to take too much of your time here going through this, but it's very simple. If you do the description, the step 1, which is the description exercise, you just use this information and plug it into the template. And as I said, if you don't need the outputs now, you can skip it for now, just to have the activities clear and the outcomes, as well as the problem and the goal, and who you will reach. The second step is identifying the stage of the development that the initiative is at. Based on the description exercise of the initiative that they did, they believe that the initiative's current activities fall within between stage 2 to 4. Public awareness and community awareness, engaging partners, and co-planning. And so they determined the current stage as such. And the third step is identifying the evaluation type that is recommended or appropriate for the initiative stage. And the guide suggests that the needs assessment is the appropriate type of evaluation that they could do now. And they might consider also a process evaluation measures for the future. But for now, what they can plan for or create an evaluation plan for is a needs assessment. And that includes assessments of the community needs, the problem, the level of readiness and the interest of the community, as well as the existing assets that exist, the existing assets in the community that could be mobilized and used. I'm not sure if I'm, going through too fast for you, but I'll try to slow down a little bit. The fourth step is to select the evaluation questions, and the evaluation database that Bonnie shared with you earlier include a number of questions suggested for each evaluation type. So the group, we worked with the group to browse the evaluation database to select the needs assessment questions that are suitable for the context of their initiative. And another aspect when we were selecting the appropriate question is that we need to make sure that the information that the evaluation question will provide at the end of the evaluation will inform the planning for the initiative. So think about the utility of the data that you will be collecting to answer these questions, and how this data will be helping you shape the initiative at the end of the day, and the trajectory moving forward. So, and it's recommended that you choose the questions that cater to diverse audiences, such as the community, your team, the potential partners and sponsors, and the target population. The questions within the database, what's good about it is that I don't know if we included that in the guide, but they are not comprehensive. This is not all the evaluation questions that you should focus on for your evaluation type, but it's meant to suggest some questions and spark, most importantly, spark some ideas for additional questions that the group believed that their evaluation or needs assessment, in our case, should cover. So these are the evaluation questions that were selected and adapted from the database. What is the geographic reach of our initiative? In what way we would like people to benefit from this initiative? How many people in our community have an advanced care plan? Are people aware of the benefits? Of these benefits? Are they interested to learn about the advanced care planning? Are community partners interested in supporting or sponsoring the initiative? Do we have volunteers who ready to sign up for the facilitator role? And what are their training needs are there training opportunities that exist for the volunteers? And what other resources that needed to support the delivery of the sessions other than the volunteers? So, and the fifth step, now we have the evaluation questions. We took the evaluation questions and we plugged them or populate them in our evaluation template, whether it's online or the downloaded version. And we are still using the evaluation database to identify the matching measures that we need to track, the things that we need to track for each question. Like, for example, for the first question, what way would the community like its members to benefit from the initiative? List of the expected benefits. What the population group that you would benefit the most from this initiative? The list of population group. For example, older adults, people with life-limiting illness. So this is the evaluation questions would require some brainstorming from the team to identify or suggest and the possible data sources for each question or each measure is also included in the evaluation database. So it's a stepwise kind of process, but it's using the evaluation database as your reference, and you have the template to plug in the things that you select based on the evaluation, based on the stage of development of your initiative and the evaluation type, the evaluation questions, moving from left to right, as Bonnie mentioned earlier. I don't know. Yeah, I think. Yeah, and this is the second slide. I covered all the evaluation questions that were identified in the previous step. So I will not go through all, but this is basically all the data, possible data sources, and all the measures that should be tracked for each question. The sixth step suggests that we explore the resources section in the guide. This section includes commonly used tools for collecting different types of evaluation data, like, for example, surveys, community forum, or citizen jury, or qualitative like interviews. So, and these tools are very simple to use. They have like, either some of them, they are just like 2 pages or 1 pager. So it's, very, very practical in terms of the information included there. Now we came to the last step, populate an evaluation template. So it's now you have, make sure that all the information that you gathered through the from the evaluation database, or from the discussion that you had with your team, or even from input from people who are evaluation consultants, or another community group who did this work before, or from a resource organizations in your province, that everything is captured in this evaluation plan template. I hope, that with this case study, I was able to demonstrate how the evaluation of an initiative in its early stages can shape its development moving forward. And we will be covering at the end of our presentations what's next. Now we have an evaluation plan. What's next? Okay,
Thank you.
so
yeah, so does anybody have any questions? I do see one in the chat here from Patricia. So her question is, where you have survey as a possible data source, do you have or recommend specific surveys we can use to measure things like, do people have an advanced care plan? It would be very valuable to have a specific validated tool in this evaluation database that we can draw from. So I'll jump on the first point and then I'll pass over to you, Eman. When we say survey at a high level, we're saying it would be good for you to create a survey and collect. So if there isn't one that exists, then you would be just creating your survey. It's like a post-workshop survey kind of thing, right? But I think you may also specifically be asking about ACP. So Eman, is there a tool out there?
we do have a tool in BC that we have been using in our advanced care planning program, the provincial advanced care planning program, and we provide that tool to all the community groups and the volunteers that we train to become facilitators. So we give them that tool, which is first there is a post-training survey for the community volunteers, and there is the post-session survey for the participants. Yeah.
Is there an option to share it in the chat, Eman?
Yeah, I can share it with you later because I need to browse our
Okay.
SharePoint, but I can share it with you later, and I'm happy to share it with the group for sure.
So maybe what we'll do is try and make sure we put it in that email that will go out in the next few days for you guys.
Yeah.
Any other questions from anybody around that specific example?
Bonnie, I'm curious if anyone here today has experience with evaluating initiative that's in their early stage, and if so, could they share their insights or experience with us?
Yeah, so if you guys don't mind, maybe in the chat, just let us know what your experience is with evaluation. That would be good to see.
And what challenges do they anticipate or did they experience when evaluating initiatives?
And if anybody has specific challenges that they wouldn't mind sharing, like, feel free to raise your hand. We have lots of time and we did that on purpose because we really want to answer your questions, right? To help you guys feel more comfortable and confident to be doing that evaluation. Okay. Oh, So Patricia says she's an evaluator lead for the Compassionate Alberta Initiative. Awesome. So we were working with the Palliative Institute was on board with our project for a little while. So that's really great to hear. You guys are doing some awesome work out there.
Thank
and
you.
hopefully the guide will be helpful. Okay, well, why don't we move on, because there will be another question section coming up. So why don't we pass it over to Émilie? So Émilie will be able to share her experience. And just as a friendly reminder, Émilie also piloted the evaluation framework and some of the pieces before it came to be the nice piece that you see now. So over to Émilie, and thank you.
Yes, thank you, Bonnie. I just want to start it to thank Bonnie and Eman for the amazing work they've been doing for years on that and for putting this webinar today. So thank you, ladies. And I saw that il y a a couple of persons from Québec. Alors, si vous n'êtes pas à l'aise de parler en français, vous pouvez poser vos questions en français et je vais vous répondre. So for the people who are French, I can take the question in French and answer also and traduct for the rest of the audience. So I would like to start with a question that I've heard a lot. It's been 3 years I've been the evaluation lead on the Compassionate Community Montreal, and I've heard a lot of those questions, and it's like, can we develop an evaluation plan for an initiative that is still in the ideation phase? Or what type of evaluation can we use, or what can we assess or track at this point? So short answer to all discussion is yes, we can do it, and we're going to explore that together in the couple minutes, and I'll be glad to answer your question at the end. Maybe you're gonna see some answers going through. So, as you might know already, starting a compassionate community project, it often comes, is not always, with uncertainties. So for this reason, the example I'm about to share, I'm hoping it will help you plan for your evaluation for all development stages that you see right now on the slide. And you can do that even though if you don't know yet which activities will need to be evaluated at the time you're doing the plan. So just to give you a little bit of context about this famous evaluation plan that I pilot tested, it is the Montreal West Island Compassionate Community is part of a larger 5-year participatory action research, which aim to co-design, to implement, and to evaluate 2 compassionate communities in Montreal, and West Island is one of them. Maybe say some social demographic characteristic because it's important. And the West Island is predominantly English territory within the Quebec province, so it's a minority language. West Island is located in a vast suburbs that stretches over the West Island of Montreal, as you can understand. It's a population of over 400,000 people, and nearly half of them are over 65. So it's kind of looking like Chilliwack, older adult population. So the overall goal of the research action project were to engage community members and citizens to develop a community response to support people facing serious illness, caregivers, end of life, death, and grief. So just to be clear about the piece I'm presenting today, they have like a research evaluation level, and they have more community evaluation level as well. And what I'm sharing today is coming from the community level. So how we take it, we pilot tested the tools that is offering the evaluation guide. So we developed an initiative-wide evaluation plan to assess the project. So I'm going to go through all the stages with you. So we're going to follow step 2 to 8. So you have a clear understanding of what to do, what to look for in each of these stages. So like Eman said, assessing community readiness is really important, because if your community is not ready to engage with you, to get on board, but you're not necessarily going to go far with that. So after you have done that and community readiness is okay, usually the next step, I'm talking about more an initiative point of view, not a particular activity. So the next step will be to perform a needs assessment within your community, and I will add with your community. So this is an important step to engage with community partners for both community development and evaluation. So you can use these steps also as a guide for your development, not just for the evaluation purpose. You can support your development through the evaluation guide. So now we are on stage 2 of needs assessments. So for our project, we choose to target community partners and community organization because it aligns with our initiative goals. So what we have done is we selected 2 questions from the database that we already saw earlier, and we select those questions based on what seems the most relevant for us at that moment. So since the aim is to assess needs, the selected questions that are in the database are crafted, as Eman already said, but it is crafted to understand what is already being done in the community in order to identify what need to be addressed by your initiative. So those 2 questions, you can read it at your screen. So are there other organizations doing similar things, and what will be different about our initiative? So to answer those questions, we choose to perform an environmental scan through an asset mapping exercise. So we ended up with a list of community organizations, the service they offer, and the population they deserve. So it enables us to identify what services are lacking in the community at that stage. And this exercise also helps, like I said earlier, to identify potential partners for the co-design, for the delivery, and for the evaluation. So for me, it is really a crucial steps that must be taken from the very, very beginning of the initiative. And then we add some guideline about the time frame you should do that. It said every 3 to 5 years, but I would say that go as you feel you needed to do, as maybe change can need can change over time in our community. So now we're leaving the stage 2, moving to the stage 3. So for this stage, we choose the question how we will get the word out about our initiative. And the target audience, I think is common. It will be usually your community, but more generally the citizen and the general public as well. So you might have observed the term marketing plan. It might sound a bit intimidating, but remember, it's just all about determining who is your target audience, so you can later assess whether you reach your target audience. So because we are in 2024, most initiative and organization will use social media and the internet to publicize their activities. So in this case, you're probably already familiar with it, but we use Google Analytics to find out the profile of the person who consults or interact with in our case, it was a Facebook page, but you can use it to know who is consulting and interacting with your social media and websites. So this way it's pretty easy to see if you reach your target audience, because it's very detailed statistic that is provided by Google Analytics, and I guess it should be some other tools like that you might know, and then I'm not aware. So it's just a way to monitor and adapt your content as your initiative progress. So this evaluation question helps to do that. So now we're going to move to stage 4, which aims to engage community partners to co-design activities, project or program. It depends of your initiative. But once we identify our target population based in a previous needs assessment steps. So in our case, we identify frail elderly, caregivers, and those bereaved. So you might come up with different things, but according to that, we're selecting the following question. So in what ways do we think people will benefit from our initiative? So to answer this question, it is very important to get the perspective from the community members, your partners, the community organization, and from those concerned by our activities. And I know here it might be not always possible, because if you're engaging with people with serious illness at the end of life, it might be an obstacle to the participation, but you can just go see some caregivers or people who working or deliver community services to the people at the end of life. You know, do something, because it's gonna help you develop a rationale for your anticipated benefits. So if you reflect on that on an individual basis, you're not gonna end up with a diverse perspective who can open up the possible outcome you might have, and then you didn't think at first. So you can do that. For our case, we did a focus group with caregivers at the very beginning of the initiative, but you can do that. You can use, you can just do a meeting, you can use a questionnaire, or you can do interviews too, if you have the resources to do so. But it's very important to get the perspective, like I said, because it's gonna help you develop your anticipated benefits. And these steps is gonna serve a later on, as you will see in a couple moments. So I hope you're still on board as we pass through the process evaluation. I know it's a lot of information, but I hope it is clear. And if you have questions, I'll be happy to answer at the end. So now process evaluation is related to stage 5 and 6, which refer to early implementation. It's usually done between the 6 to 12 months prior to the initiation. So I would like to remind you at that point that the plan I'm presenting was conceived before we knew exactly what target population will be and what the nature of implemented activities. We didn't know at the point what kind of activities will be developed, but you can still use the evaluation plan to contribute to the development of your initiative. So for stage 5, our target groups, I say target groups, but it is an evaluation purpose, just to be clear. It was our team, so the research action team staff and community partner engaged so far. So we choose in advance to evaluate if all activities were delivered as planned. So to answer this question, it is very important, I stress out about that, but it is very important to keep track of your initiative development process for each stage. So it's going to be easier at the end to do your overall evaluation. So at that point, if you, with this question, all you have to do is compare the list of completed activities against those planned within 6 to 12 months. I will say maybe more close to 12 months to do that. So yeah, you have time to really see what activity can be delivered or not. So now we're going to stage 6. So again, the target groups of the evaluation was our team, community partners, and of course, target population or the activity participant. So we were wondering if there is anything about the design or the delivery of the activity that worked really well or that could be improved. So to answer this question, we decided in advance, but since it's like past, I can say what were our experience. So we mostly use satisfaction surveys with an open-ended question at the end to get the perception from the participant. And of course, it's a research project, so we did interviews with community partners and our team. So you can repeat this exercise. You know, we put some time frame, but you go as need rise. So you can do it every 3 to 5 years, or like I say, as need rise. All right. So now moving to the outcome evaluation, so a little bit further down the road. So stage 7 is associated with the outcome evaluation and is all about mid-implementation. Usually it's going to be performed within the 2nd year of your program or your initiative is running. So in our case, we selected the question. In fact, we wanted to know, of course, what is the key outcomes and to what extent the short-term outcomes were achieved as planned. But we did that like for all activities, so you might want to focus on just one at this point for you. So like I said, because I just want to separate the research project from the community organization use of the evaluation guide. So of course, they have something that I'm presenting you about the outcome evaluation that is done at the research level, such as like participant observation and interviews with community partner to identify the key outcome and to what extent they have been achieved. I see we have a couple minutes, so I might open a certain way about the participant observation. It is not really in the guide. But as an anthropologist, it's my main data collection tool. So it's my mind and it's my body. And I'm taking the time to talk to you about that because basically everyone can do participant observation, and it's an easy way to get information you will never get through surveys or through interviews. And it's not very, you don't need to go to university to know how to use that. We use it with teenage participating in research, and they love doing that. It's pretty easy. So you won't find some tools for participant observation, but keep that in mind as a way for you to collect data about the outcome. So I'm closing that chapters. So now to keep it simple, I don't want to mix everybody, but to keep it simple for the outcome evaluation, you can simply compare the list of anticipated benefits you made at the stage 4 to your identified outcomes that you get in stage 7, which you usually done that 12 to 18 months after the initial implementation. So for example, you can do a Google form, like a satisfaction survey, but you added 1 or 2 open questions about what is the most significant outcome as perceived by your partner and participant. And as we saw with Eman earlier, I think they have like a different conception of outcomes. They have the outcomes that people think more about the change they have been in their life or in the particular domain. but they are outcomes that are seen more like outputs, like it's the result of the action and the funding and the resources you put in the project. So, I mean, you have to pick up your side, but if you take the outcome as what change did we do in the life of the people we're reaching, so you really can have the perception of your participant using a Google form to identify your outcomes. But you can also perceive if you see more outcome like output, you can do an initiative mapping. You can also, you can use focus group. There are many ways of getting to identify your outcomes. So now, last but not least, is the famous impact evaluation. I don't see the audience, but I can imagine eyes rolling when people hear impact evaluation. I understand it's really a big piece, and it is often required when it comes to reporting to your funders or funding organizations. So let's see how we can work this through using the evaluation guide. I'm going to do my best to summarize that in a couple minutes. So like I said, when it comes to, I say compassionate community, but it is true for any social innovation, intervention, or complex health and social intervention. But when it comes to impact evaluation, here we usually refer to the impact you have on your target population, but also on community members, the community partners, and the community organization. So you can have an impact that it's much wider than you think first, because we often have the population we target in head, but the impact can be much more bigger than that. So I'm going to take just a sec. So as you develop your initiative, you will be able to identify one or more target population, one or more area of action, according to the need you identified first. So my advice would be to choose an impact indicator according to your target population and the issues being addressed. So for example, if your activity aims at supporting caregivers, you may want to select an indicators related, let's say, to caregivers' burden, and choose an associated measure such as social support scale. And I'm not saying that you should use such a scale to do statistical analysis and to publish in scientific journal. It's not that. It's that you use it as a tool that indicated to you that you have an impact in that specific area. So I think I have a question about something like that earlier. Maybe we can talk about a little bit after I'm finished. So like maybe it's maybe because I'm an anthropologist and a qualitative researcher, but for me, I observe that impact evaluation is often, if not always, associated with what can be measured and quantified. So funders often require such impact evaluation from the beginning, but it's not always possible. It's not always relevant or appropriate to do so. So in particular, when you have implemented several activities involving a different population, but the number of participants by activities, let's say, is 10 to 15 participants by activities, it's too small to be able to carry some statistical analysis, or you might don't have the resources to engage someone who will do this kind of statistical analysis. So the good news is there are many creative ways to evaluate the impact of your compassionate initiative, whether it's through what we call qualitative impact stories, so basically storytelling that will highlight the impact of your activity have on the person you're reaching. You can use open-ended questionnaire also that you can analyze like very easily. And you can ask in this open-ended questionnaire, You just ask what is the most significant impact, and then you target the different person that are engaging in compassionate community activity program or initiative. So they have many creative way, maybe because I know we have sometimes I can slip and venture into an example I've heard from, I think it was a compassionate community initiative in Australia. And what they have done, because they target caregivers caring for a person at the end of life at home. So what they have done is that they want to increase the social networks to support the caregivers. So they just ask their participant to draw their social networks before the initiative start and after. So you can really have a visual, the social networks doubles or triples or whatever. So it's creative way that you can use for impact evaluation. So otherwise, to come back to the evaluation guide, there are resources available to support you in your impact evaluation. There are a number of free tools available online to support you in that important step. We have a couple, we see a couple really quickly, but they have amazing work like the Rainbow framework, the community toolbox. And if you're still feeling overwhelmed by the task of impact evaluation, you can also take advantage of the Tamarack Institute personalized evaluation coaching services. Just to say, I'm not affiliated with Tamarack Institute. I just find that the tools that they provided, the webinars and the coaching services are amazing. Is it a Canadian institution? They have a lot of free available materials and tools, but you can also pay to have a more personalized evaluation consultant services that can be really helpful for you. So just to conclude, my advice is to start with large evaluation question that you can specify and adapt as you go along with your initiative. So like I said, it can be a tool, yes, to evaluate, of course, but to support the development throughout the stages. So the guides provides a flexible framework to support you in your evaluation journey. But remember, this tool is a guide. It's not a fixed protocol from which there can be no deviation. So you can always come back and change things as things are changing. So I will finish by saying that some people say what can be measured doesn't count, but remember that what really matters can be measured. So thank you.
Thank you, Émilie. And to just sort of jump on some of the few things Émilie said at the end is another evaluation one that I heard, it came from Tamarack. I'm a big Tamarack lover as well, is the idea that you need to include two types of data. They call them thick data and thin data. Thick data being stories. That's the stuff that you're going to put in your funding reports. That's the stuff you're going to put in your impact reports. And then your thin data, which is your numbers, right, is more your quantitative data. So, you know, it's pulling in a combination that's going to get you both those pieces when you're thinking about those questions. Okay, thank you, Émilie. That was awesome. It was so great to see how the Montreal project has used the guide and that it was helpful. So we do have two questions that came up and they are in the Q&A. So the first one is from Patricia. And so I'll just read out the question and then maybe the three of us can look at answering it. And I know someone put a possible solution in the chat. So her question is, I'd say one of the challenges we have is working with our stakeholder partners to obtain outcome data, i.e. change in knowledge, attitudes, behaviors among people who participate in various outreach activities. For example, if one of our partners offers a workshop, how can we get their buy-in to either distribute a post-event evaluation or survey and share that data back with us, or allow us to manage, coordinate the survey, and have the data come back straight to us. We've had lots of interest from partners who are doing great things in their communities, but not always the buy-in to help or contribute to the evaluation. Would be interested to hear potential approaches. So, Eman, do you want to take that first?
Sure. Yeah, I'm happy to share our experience in BC. So our community-led advanced care planning program that's being managed by the BC Center, my home organization, BC Center for Palliative Care, went through a number of went through a kind of evolution of in the development. So we started first. The short answer, before I go into this information, the short answer is that you need to provide something to the community partners in order for them to, so they can share the evaluation data with you. In the first year of our program, what we did is that we did a thorough evaluation of our program, and we basically give the community partners who wanted to test with us this model some seed money to basically help them with the logistics of delivering the sessions and evaluating the sessions with us. And we took care of the evaluation from A to Z. And because it was a research project, the evaluation tools that we created, like the surveys, as I said, the post-training survey, as well as the post-session survey for the participants, and some interviews were very long and thorough. But that was for a purpose. We wanted to generate some evidence that this model is effective. It's like, you know, it helps people engage in advanced care planning. It helps people gain more knowledge. It also helps the volunteers to feel confident to deliver these sessions. They have all the resources that they need. So that was the first year. And then after that, what we did is that we simplified the evaluation. Now we have a program that proved to be effective. We simplified those surveys in order to make them, you know, more accessible and more user-friendly, if you will, for the community partners. And the idea that we came up with is that, and we wanted to get this data from them. So what can we do? Like, we thought about creating the evaluation survey in one of the center's account, like in SurveyMonkey, and we basically, after we trained the community volunteers, and we provided them with the link to that survey. We said, like, this is the survey, the post-session survey. It's already online. Like, you know, you can share that with the participants in your group who would come to the session, so they can complete it online, like if they have on their phones or whatever, or when they go home. And that will help, instead of, like, you know, printing a survey that or questionnaire that the people will fill out, and then they have to do data entry and then analyze it, and they might not have the resources to do that. So we told them this will, I think, solve your problem. If you ask the participants to fill this online survey, you can come to us at any time and say, on that day, because the survey questionnaires or the survey form has the date of the session, and they need to enter the date of the session that the participants attended, and also the name of the group, the community group, and the community. And so they only have to come to us and say, on that day we conducted a survey, a session, and we need all the participant surveys completed with an analysis report. So with just a click of a button, we generate, like, the analysis of these surveys in a report, and we share that report to them. So it's a win-win kind of, we created a win-win situation for us. to have access to this data. We know that we will not be able to get the evaluation surveys from all the sessions that our community partners conduct, but it's like we get like a considerable amount of data from this, and at the same time we are helping the community partner to evaluate their own sessions and get an evaluation report without the need for doing data entry and finding someone to analyze the data for them and that. So it's short answer is create a win-win situation. So to ensure engagement.
I'm mindful of time, but Émilie, do you have anything you want to add to that?
Yeah, but I'm totally agreeing with Eman. You have to have this partnership, but I would say that because I think it's something a challenge we all face. The other thing is that you can, in this win-win situation, you can also say there is data that you can use to report to your funder or for another funding. So usually people see the opportunity and the buy-in's gonna come through that. So it's really a win-win, a partnership really.
Yeah, and I would say one of the things that I think to add is understand where they're coming from. So you may have noticed I dropped the sustainability guide link in the chat, and that is full of resources to help you with those partnerships and navigating that stuff. And one of the tools in there is called Give, Gets, and Constraints. And so the design of the tool is to actually do it with your stakeholders and have everybody talk about, okay, here's my constraint, like I don't have a lot of money or I don't have a lot of time, right? So once that's out there and in the open, it makes it easier for maybe you to sit and go, oh, that's your challenge, we can help you with that, right? So then it starts to create what Eman and Émilie are speaking to. So it's another really, really great tool to build trust with your partners, your stakeholders. And like I said, it gets the stuff out there on the table and you understand what people are hoping to get from the partnership, but what clearly their constraints are.
Totally agree. Yeah.
Awesome. So we have another question from Dave. Dave said, we are just looking at this initiative and are not sure of the difference between the advanced care planning and the compassionate caring communities. Dave, would you mind unmuting yourself? Is there any sort of other context that might help us with that question? Is he still with us? He's there, but he's muted. So, I mean, I'll just jump in quickly. I'm not quite sure again what exactly you mean with the question, but I mean, caring communities can encompass many different things, right? So they can focus just on grief, they can focus just on caregiving, they can focus on a spectrum. And certainly the advanced care planning initiative that Eman brought up at the beginning is focused on getting people to get involved and create their advanced care plan. So basically compassionate community initiatives, as they should be, have a variety of different activities that they're running. Dave, I saw that you've unmuted. Does that answer your question or?
It's the compassionate caring community, sort of a catch-all from, A to Z sort of thing. And this advanced caring plan, I'm not sure exactly what that covers as far as, well, I guess what does it cover? What's the impetus behind it?
Go ahead, Eman, because that really is your initiative, but.
Yeah, advanced care planning is a process where people reflect on their own beliefs and values and wishes for the care that they want at any point in time when they have, like, for example, going through a serious illness or a serious accident, or like a health situation that's really will have an impact on their future health, or maybe at end of life. So it's reflecting on that and then sharing these values and beliefs and wishes with the people that might be in a situation to make a decision, healthcare decisions for them, like whether receiving like like CPR if needed, and the person cannot make that decisions themselves. So these people, like representatives or substitute decision makers, or even the healthcare providers, your primary healthcare provider, need to know about your wishes. So it's and then the last step is, after you share this, you need to make sure that this is recorded or documented in some form, in some format. Like it could be like recorded as an audio or a video, or documented in a paper or a letter to your to share with your partner or with your children, or formally kind of create legal documents, like in BC we have a representation agreement or advance directives. Like it's so the main purpose or the main goal of the advanced care planning is to help people get the care that's aligned with their wishes, whether they have the capacity to make these decisions, or enabling others to make those decisions on their behalf if they cannot make them.
Thank
So
Thank
Patricia
you.
just made, she just made a great comment in the chat. And for compassionate communities, I would think of it as sort of like participation when it came out, right? Participation was like a movement, and it was all about getting people active. So compassionate communities or compassionate care communities is all about getting the community more comfortable to care for and support people who are caregiving, dealing with serious illness, grief, bereavement, right? So advanced care planning falls as one of those activities within compassionate communities. Hopefully that
exactly. And actually in BC we recommend any group who are still like thinking about creating an advanced care, a compassionate community, they start with advanced care planning. And this is the exact advice that we gave to the community group in Chilliwack on my case study. They were just community members coming together. They love the compassionate community idea, and they want to create one, like a group, an initiative, and they didn't know where to start. Where to start from. So we advise them to start with advanced care planning, like delivering advanced care planning information sessions, because it will open the door for them to interact or reach out to a large segment in their community, not only people who are needing care, one-on-one care or support, like a caregiver or a person living with life-limiting illness, but it's for everyone who could be a caregiver in the future or now. So they will be introduced to the concept of advanced care planning and link that or introduce that under the umbrella of compassionate communities. So you might have the opportunity to have volunteers signing up for to join that group. So, and it proved, that advice proved to be a good advice for them. Now they are a very well established group, and they have multiple programs, including advanced care planning, including pairing teenagers with seniors at home to address social isolation. They have a compassionate care support group. So yeah.
Awesome. I just want to acknowledge we have 5 minutes left. We do have a couple more slides, but I mean, if we don't get to them, they're pretty self-explanatory. So there's one here for you, Émilie, and I suspect, Eman, you may be able to jump in on this. So the question for Émilie is, curious to know if and how you measure outcomes of grief and bereavement. Can you say more about what metric strategies you use to do this? And Eman, you may have examples as well from BC. So Émilie first.
Yeah, but I will talk from my perspective, which is evaluating action research project, and this is participatory evaluation. So it's not like the researchers have all the control and gonna decide the metrics and do the things. But what I want to say that is very important, because when we're talking about measurement and outcomes, sometimes, like Eman said, compassionate communities is engaging with communities to develop something. So it took years to bring about results, so that we can evaluate it. And usually when the most important impact shows, the funding is over and there is nobody there to initially evaluate it. It is one of the biggest challenges in the compassionate community movement, how we measure the impact. And the other things I will say, you talk about grief and bereavement. We have the death literacy index, which was developed by other researchers facing the same thing, like how we measure things. So you can use that, but I caution that you should have a lot of participants to can get something from that. I will say some example from the Montreal project. We have the West Island, which is an older population. So the needs is around serious illness, support at home, caregivers, advanced care planning. We also have another site, which is in Centre Sud, which is, the issue is completely different. They have a lot of homelessness, mental health. This neighborhood is really touched by the overdose crisis that's going on. So the grief and bereavement, we cannot look at that as one thing in the two sides. It's going to be tailored to the needs of your initiative. So when we say compassionate communities at large, it can be many population reached through diverse program and project. So if you want to measure your outcomes in grief and bereavement, I will suggest to be sure that you have enough participants and the buy-in of your stakeholders, because it is something that it is a well-known barrier. So about the metrics and the strategy we use, I talk a little bit about that, the strategies of participant observation, because it allows me to be with people, to take notes, to hear. And at the end of each session or activities, they have an evaluation question, so I can take notes. So the imprint is minimal for the stakeholders, but I can understand that it's not everybody who have the time to do participant observation or the skills but you have to diverse the strategy. Now, if you want to measure the impact, we are now looking for funding so we can extend it and really do the job to measure. So that's what I'm going to say, I think, about that.
Eman, did you want to jump in with maybe any specific measurement pieces for grief and bereavement being used out in BC?
It's basically the impact of the initiative or the activities that involved in that initiatives on the person's ability to cope with the grief.
Mm-hmm.
We want the support provided through the grief and bereavement program or initiative to prevent the normal grieving experience to transition or to transition to a more complicated one, right? Or a mental health problem. So it's key that we measure the impact of that on the person's ability to cope with the emotions involved in the grieving experience, and how they feel. Do they feel like, how often they feel sad, the impact of that on their work productivity. It's a multiple things, but these are the ultimate outcomes based on the hoped objectives of the initiative.
Great, thank you. So we can stay on for a few more minutes. We do have another question in a couple of slides. So if that's okay and you can stay on, please bear with us. The only other thing that I would say around the grief and bereavement piece is that's where, if it's feasible to do, maybe assess the people before they start an initiative, whether it's a grief and bereavement support group, what have you. So ask those questions that Eman just mentioned, and then ask the same questions at the end, and do it on what we call a Likert scale, right? 1 to 7 or something like that, so that they give their number before going through whatever the activity, workshop, what have you is, and then reassess it after. And then that feeds and gives you the information you need around the impact that has been made, right? And then ask them to share feedback as well. So that would be a way to use what Eman and Émilie have talked about, if you ideally can, a pre and a post, basically. change in attitudes. The other quick question that was there, but I see is gone. It was something about what do you do when stakeholders maybe just you have people interested, but they just can't seem to commit. I think that was roughly the question. You know, certainly, again, I go back to the give, gets, and constraints. If you have people who are interested, take the time to do that activity. It's just a little like template you fill out, basically. But also, I will say I've had this happen to me. Eman and Émilie, I'm sure you have witnessed this. You know, I used to do compassionate communities work on the ground in the Burlington, Niagara area. And I had people who were really interested, but said, I'm not interested at this time. Like, we do not have the capacity, you know, and I just said to them, okay, that's great. I recognize that. If you think you have capacity in the future, like, feel free to reach out to us and we'd be happy to see about, you know, bringing you back on board, right? Like, sometimes people truly are just tapped out. And you don't want a partner or like a partner in your initiative who's just doing nothing, right? Because it's energy that you're expending that not necessarily the group is getting anything back from. So sometimes they really are just too busy. Eman or Émilie, do you have any other sort of suggestions for that question?
You can go ahead, Émilie.
Yeah, I'm thinking about the different contexts because I have like two different compassionate communities. It was an issue in one of those, and then it took maybe like 3 years to gain, you know, the confidence or the trust of the community. Yep. And I, because it's the researcher point of view, but it's like how our research can support you through this. So find something, and sometimes it's just go where they are, go meet them where they are. Yeah. So it's the way it works, but it took long time. So the people just trust in all of you and don't feel that you're gonna put additional work on their shoulders. So you can ask, what can I do for you to ease your participation or whatever can we use? But sometimes it's not just you're not successful because the load is very heavy on the shoulders. So, but like you said, Bonnie, you keep the door open, or sometimes it can be that you have like a visit card. Here's what we have done, what we achieved with that group, and people. Usually it's the compassionate community concept is attractive, so people want to be a part of it. It's another way to get them, but like I say, it doesn't get the overload over their shoulder, but it's incentive that you can use to engage partners or stakeholders.
Eman?
Well, my answer really depends on who is seeking this advice. Like if you are you know, working with an organizations like my home organization, the BC Center, coordinating or catalyzing and supporting compassionate community groups, well, you know, what we do is that when we reach out to potential community partners, we show them or share with them the evidence or the results from our research project, the 1 year research projects that we said, like, this is the impact on the community partners, like, you know, how this having or establishing a program, compassionate community programs, help them to achieve X, Y, Z. How on the volunteers, this is you know, what are the benefits for the public and the community. This is the impact or the benefits. But if you are affiliated or part of a community group, now you are in the local community and you are reaching out to potential sponsors or support businesses that you would like them to, you know, partner with you or sponsor your activity. This is a different story. You need to put your shoes you put yourself in their shoes, saying, like, you know, they could have a passion for endorsing or supporting or sponsoring that, because the compassionate community is a good cause. It's a novel kind of concept, but maybe they don't have the resources, or they are not ready, as Bonnie mentioned. So you need to think about what is an element or part of their business that, or what the work that they do if they are not a business, that their participation or their partnership with you would help them with. Like, for example, one of our community partners, they reached out to a primary care clinic, and they told them that, you know, we can help you, you know, if you have a patient who is struggling to get support at home with these aspects, the non-medical aspects, we are happy to provide that. And, you know, this is, you can refer them to us. This is, you know, or to get this free support, or they can attend like your other patients, they can attend these sessions. So it's basically presenting the support that you provide as part of your compassionate community program as an added value to the potential sponsor or the potential partner. So that will raise the profile of their business or the service that they provide. So you need to think about what they will gain by this, other than, you know, endorsing a good cause, you know. So again, I think we apply the win-win situation across any part that involves partnerships or collaboration. So I hope I was able to share our thoughts clearly.
Yes, thank you, Eman. And I would just say, building on something that Émilie hit on, is the trust piece. Like, and all the community development courseware, all the stuff that I've done, it all says, you know, these types of initiatives often move at the pace of trust, right? So, you know, they may be just saying they're too busy to you because they joined a group once before and it did not go well. So they just don't want to go, right? So, you know, taking the time to sort of try and understand potentially why. Are there any other sort of hidden pieces there that you're not aware of, right? Like they put all this time into another initiative completely different from yours and it backfired, right? And so they just don't trust you just because your initiative sounds similar to the one that they were involved in before. So trust really is a big part of it, of people letting their guard down and being honest and sharing their challenges or concerns or fears, right? So gaining their trust is a big piece. Okay, so I realized that we have an extra half hour. Sorry about that. My brain thought we were finishing at 2:30. So we've got some time to finish those last couple of slides. And seriously, if you have any other questions around how to use that evaluation guide or what have you, like, you have more time with us. So please do. Okay, over to you, Eman.
So from the 2 case studies that we shared with you today, we ended our presentation parts with, now you have a plan, right? An evaluation plan populated and ready. Now what? So the good thing is that the guide, you know, provide some or suggest some steps for the following stages or phases of the evaluation. It outlines the steps that would, you know, involved in each phase. Like the graphic here of the evaluation phases starts with the plan, and we completed that. If you are like assuming that in case 1, in the case study 1 and the case study 2, we created a plan, then the next step would be to collect the data, conduct the evaluation activities included in your plan by collecting the evaluation data through the surveys or the community forums or interviews, or even from the literature, or talking to key informants like people who are, or other groups in other communities, similar communities, or expert, depending on the data sources suggested in your plan. And before doing that, I really recommend that you take your plan and have a discussion with your group, review it together, you know, come together and review it and think about, again, have another look about the utility of the information that will and the data that will be collected through the suggested plan. And it's okay to refine the questions, refine or revisit the data collection methods. Because you need to consider the visibility and the cost associated with the data collection. Like if the only data source that will be like a community forum, or the suggested data source or data collection is a community forum, that you need sponsors. Otherwise, you cannot like conduct this for free unless you do it online, and that might not be very effective, especially if this is your first interaction or encounter with the community at large. And then the second step or the second phase will be analyzing and summarizing the evaluation data in terms of like, if it's quantitative data, like numbers, this is like the percentage, the numbers, etc. If it's qualitative, then you need to do some summarize the findings by themes that make sense to the group team, so they can review the evaluation, the initiative plan, and inform that the design of the initiative and the components. And so this is the act that you need to use the data to inform the either the shape or the design of the initiative, or improve the initiative if the evaluation is a process or outcome evaluation. And it's recommended that you revisit the evaluation plan as you go, because your initiative will develop, will go through evolution. So you need to update the evaluation types and the evaluation measures and questions accordingly. I think we came to the last kind of suggestions or advice from all of us. We suggest that for further information and guidance, that you review the resources section in the guide, and maybe reach out to the organization in your province that provides support for compassionate communities. For example, in BC, we have the BC Center for Palliative Care. In Alberta, there is the Covenant Health, the Palliative, the Institute of Palliative Care Institute under Covenant Health. In Ontario, there is HPCO. In Montreal, also there is the Émilie's group. And if you don't have an organization like similar to these ones that provide provincial support, reach out to Pallium Canada. Even if you are from any of these organizations in these provinces, you can still reach to Pallium and they will refer you to us. So you can also consult a peer organization or group doing similar work. If you have money or funding, that then I think it's a good investment to hire an evaluation consultant to establish or develop a robust evaluation plan for you that you can use to collect data, or you can use a student trainee from any of the universities in your province to help you with that. And actually at the BC Center, we have been using student trainees every year to help us with anything that relates to evaluation or small research projects. So it's a free resource. Take advantage of that. And yeah, and now we are to the acknowledgement. Thank you. So is this Émilie who do this, or you, Bonnie?
Yeah, so, as I alluded to in the beginning, this project, I think, started about 2015, 2016. Eman and I were sort of the part of the core team, and we have had many people help along the way. And so, we just want to certainly acknowledge that. So Nadine Volk was a part of our team for a while, Julie Darnay, they both were working with HPCO. So HPCO has absolutely been a big supporter of it. We had consultation help as well. Pam Martin was amazing at helping us put it in plain language. Sometimes we'd say things and then she'd be like, okay, but in plain language, what does that mean? So she was wonderful at helping us with that piece, as well as Deb Sattler helping us with the evaluation portion. And then the advisory committee, so Émilie is a part of that, Conrad, as well as Anton, who is at the same organization as Émilie. And then we had student volunteers, as mentioned earlier. So we had quite a few of them over the several years, including Aaliyah, who's on with us today as an ECHO support staff. So thank you, everybody, for sure, who has helped us bring this to life over the last few years. Yeah, so session wrap up is just, my earbuds have gone dead. Session wrap up is just, you may have seen the survey that we just put in the chat talking about surveys. So if you can fill that out, because the ECHO program uses them to show the impact. So please make sure to do that. And then as well, that we will be sending that out to you guys. We will add in some of those resources that we talked about today. So you'll get that, I think, probably in the next week, once the recording's posted live on Pallium's ECHO website. And yeah, that's it. Are there any other questions from anybody, or Eman and Émilie, anything you sort of thought that might be great to share?
No, I don't have anything to share. It was really great questions. I really enjoyed all of them, and they are very helpful, I think, for everyone to allowed us to share our own experience and thoughts. Thank you.
One of the things that one of my first manager's bosses in the compassionate community space used to say to me all the time, because I'm a bit of a doer, I like to get things done, which is not always a good thing, and certainly counterintuitive to this work, is, she just always used to say to me, this is not a race, it's a marathon, right? And so I constantly remind myself that, because sometimes I get bogged down in, oh my goodness, like, we're still doing this. We even had those moments in this, with this project, but it reminded us that to do it right, to do it well, it was going to take more time, right? So you're having those moments where you're feeling like you're not moving at the pace you'd like to move. That's probably accurate, because to really build the trust and to get people on board, it takes time. Awesome. Well, thank you for joining us. Please provide feedback once you've had a chance to look at the evaluation guide. Like I said, there's that piece right at the start of the guide. You'll also notice in the evaluation guide is a definition for the Canadian compassionate communities, which came out of this project. So if you haven't seen that, I would encourage you to have a look at that and see sort of what we believe the guiding principles are for compassionate communities movement in Canada. And as Eman mentioned, please reach out to any of us or organizations. We're here to help. We, want to continue to show the impact of this work across the country. So let's work together on that. Awesome. Have a great day, everybody.